Let me introduce you to two women. This is Yukabith of Kenya, and this is Elizabeth of Australia.
So Elizabeth is from Brisbane in Australia, and she is pregnant with her very first child. And after taking a pregnancy test at home, which results positive, she schedules an appointment with her GP. He informs her that in Australia there are a variety of prenatal scans in order to eliminate any risks during pregnancy, and these are spread out during 3 trimesters. In the first trimester, the first step that occurs is a dating scan, which occurs during the first 3 months of pregnancy. It is called dating scan because its main function is to calculate the due date of the fetus. However, it also confirms the numbers of babies present, and it is just needed to confirm the pregnancy overall. Then you have a second test, which is the maternal blood test, which occurs after the 10th week of pregnancy. Here, blood is taken from the mother, which contains part of the fetus's DNA, and it is then tested for trisomy. And then you have a third test, which is CBS, the third picture, which is chronic villus sampling. This is when women have a high risk of inherited diseases. CBS is performed, which is basically taking a sample of the placenta and then testing it for genetic diseases. And then the second trimester, you have 2 more tests, which are amniocentesis and the morphology scan. The amniocentesis occurs between the 15th and the 20th week of pregnancy, and they can be compared to CBS. They're almost the same. However, CBS occurs earlier during pregnancy, and that is why it is preferred over amniocentesis. And then you have the morphology scan, which is essentially just an ultrasound in order to look at the baby's growth, the development, and if the parents want to look at the sex of the fetus. Last but not least, we have the third trimester, which consists of one main ultrascan in order to look at the fluid levels and the location of the placenta. However, the GP informs Elizabeth that there are more tests that she can do, such as the hemoglobin and platelets count. This is because there is a risk of thrombocytopenia. Then there's urine tests, group B streptococcus, and STD tests. The GP furthermore informs Elizabeth that she has a variety of options where to give birth, such as a hospital, a midwifery center, a birth center, or just at home. However, at home, she needs the assistance of a midwife, and there need to be low risks of pregnancy.
Yukabeth lives in a village in Namanga in Kenya, and she's right now pregnant with her 3rd child. In Kenya, they as well do prenatal diagnostics. One of these is a maternal blood screening, where they check the blood for Down syndrome or trisomy on the 18th chromosome. They also do one first and third trimester screening. And in the screening, they check for example, neural tube defects, and they check if the child has syphilis or HIV test. Other things that are in Kenya are like the mother-baby package funded by the government and UNICEF. They check if they actually want to stop the transmission of HIV between the mother and child. They do this with a package of antiretroviral drugs and prophylactic antibiotics. The mother and the child have to take them. It's 14 weeks after 14 weeks of gestation and 6 weeks after delivery. They also have the malaria package. They do this in an intermittent preventive treatment during pregnancy. This is actually saying that during these normal checkups, she gets the SP. SP is an anti-malaria medicine. Even though she's not affected by malaria, she can do this, and she'll get at least 3 doses to prevent the malaria. The difficulty she'll encounter is, for example, the infrastructure. In Kenya, the roads are bad, and it can take up to 300 kilometers to reach a clinic. And once you're at the clinic is overall very overcrowded and understaffed. Also, 86% of the Kenyan women, they get antenatal care. 64% of them want to wait till the 3rd trimester because, for example, the overcrowdedness and because it's super expensive, and there's a lack of knowledge, so people don't think they need antenatal care. And a common thought in Kenya is that they want to figure out how to give birth themselves so they can help other women.
So while Australia focuses more on the social and emotional part of the pregnancy and on the trimesters, Kenya focuses more on HIV and on struggling with overcrowded hospitals. So if you want to compare the 2 countries and to see their main differences, you look at the mortality rate, and you can see that both for infant and maternal mortality rate, Kenya is much higher than Australia.
We think that prenatal care should be more readily accessible for everybody. If you agree with us, you can get involved in organizations such as UNICEF, ISPD to support countries such as Kenya. Now that's an idea worth spreading.